Hi, I'm Liz DeJongh, and this is my sister Franny. This is my interpersonal skills video. Okay. Hi, Franny. How have you been lately?
Been good. Just really busy. How about you?
Oh, I've been good. I was wondering why we haven't hung out lately. I didn't know if you were busy with class or you just didn't want to hang.
I've been really busy with class, actually. I've started my internship at Wilcox Elementary in Holt, and it's just a really demanding schedule with grad school right now.
Nice. I've been busy with class as well.
What classes are you taking?
Well, this online speech class, and then also I'm taking my health unit coordinator class in order to get certified to be a health unit coordinator.
Do you have to take a national board or anything like that to be a health unit coordinator, or a state board? Is there a test that they have you take?
Yeah, but you're supposed to wait a year after you start, after you start working in a hospital to take it. You don't have to take it to start the job. You just have to take it, I think, to keep going.
Okay.
I'm not sure completely.
So, but it is a certification?
Mm-hmm. Either way, I have to pass the class, and that's kind of like a certification. And then clinicals start March 15th, and then I have to go there for 4 hours. But they're changing the computer system. They're changing to all medical records are electronic.
Electronic, yeah.
Yeah, and so I have to train on computer mostly. But I also have to pass because I'll have an instructor, and they'll have to pass me as well. So it's bookwork, and it's just, you know what I mean?
How long is that class, and how often during the week?
It's twice a week, and it's 4 hours each time.
Oh, wow.
Yeah.
That's a lot.
Yeah, and there's just a special book for it and stuff.
Is the time that you're going to be in the hospital, is that included in that 4 hours, or is that after?
Yeah, starting March 15th is when every Thursday is the clinicals, and then every Tuesdays I'll continue with my class.
Will you be placed at, underneath a existing health unit coordinator?
Yeah, and then just there's two different clinicals. There's one at Sparrow, and then there's one at Ingham, and there's two instructors, so it just depends. But you know Eric Wells or whatever. I went over there for dinner the other night, and they both work in administration.
He works at Sparrow too?
Yeah, him and Megan. And then Megan's the one who does hiring for the Hawks on certain floors, but she's in labor and delivery, and I don't know. Yeah,
be so
if she hired me in through there, it'd be so amazing.
I wonder if that's a harder place to get in because people want to be there probably.
Yeah. And just probably, I don't know though, because health unit coordinator is already really hard, and stressful, and
so maybe.
And I feel in a high tense, in a high tense situation. She said how there's girls that would start their job and then they would seriously just quit the next day after they did the whole semester of classes just because they couldn't do it, just too overwhelming. But I think it just takes experience, just like any job.
Yeah, for sure.
Paraphrasing. Dang. But yeah.
So, what makes you think that you have what it takes to be a health unit?
I'm good at multitasking, and either way, I'm just going to want to move on in my life pretty soon. But yeah, I did a department report at my physical therapy. I did the health unit coordinator. She's a secretary, but I had to ask her a bunch of questions about just about the department because it was department report.
That one lady that works
Jan.
She's really nice.
I know, she's so nice. So then it made it 1,000 times easier because she was so polite and nice and is more than willing to answer any question.
She would always have to come Timo would start that electro thing on my knee.
Takes it off.
She would take it off so that he could go start therapy with other patients.
Yeah.
Are you still in physical therapy?
Yeah, I have to go till March 8th.
Jeez.
So it's been 2 months right now since I sprained my ankle, and then it'll be another month.
That's terrible.
I know. And a girl at my work, yesterday I found out she broke a bone, but she thought she had broken her ankle. But Timo said that she'll be healed before me. Yeah, terrible.
So you sprain the ligaments, or you tore a ligament?
I tore 2 ligaments completely, and then
You partially tore 2 others.
And then by the time that I went to the orthopedic surgeon, they said that I couldn't get surgery because it was already scarring. But then Timo said today that, like, since it's scarring, it's even easy to, like, tear apart even now. So, like, keeping it in, like, my, like, lace-up thing.
Wait, what do you mean about it's easy to tear?
Well, just because, like, when it scars down, it's, like, different, like, I don't know, it's not completely, like, you know what I mean?
Cohesive anymore?
I don't know. It's not completely... Let me think of how to paraphrase. No, but it's kind of like, it's just like when it scars down, just some of it's starting to attach. So not all of it's attached yet. So it'd be easy to like re-injure it and like re-tear it completely again.
That would be terrible.
I know.
Don't twist your ankle.
Right. But I went into Finley's yesterday and tripped, and I wasn't wearing my ankle thing, and I almost, like, sprained my ankle again.
That would be terrible.
Legit.
You should probably ask me some questions.
Me. Yeah, let's turn this around. But, so why do you want to be a speech pathologist?
I want to be a speech pathologist because there's a really good job market for it, and I like that it's a really versatile job. Like, I can work with little kids or I could work with adults. And I'm not really sure which population I want to work with. And so it's nice that I have that option. Even when I graduate, I could change my mind, like, halfway through, like, my career and change to working, like, you know, with a different population.
And you're doing clinicals at, like, every setting, right?
Yeah, it's nice. This year we're going to be in schools, and then this summer we'll be in hospitals, and then in the fall I'll probably be in like a nursing home or like outpatient rehab facility somewhere.
Nice. And then the people you work with completely varies from like children to like elderly.
Like people, I mean, you literally can work with infants that are like premature. I mean, like the very beginning of life, all the way to like many people working in nursing homes, they, you know, see their patients pass away and stuff. So it's all stages of life for sure. Not very many people, I mean, in the brain injury, like the people who have had brain injuries, they can be like middle-aged, but not as many people will be middle-aged. It's more like early life and later in life.
Okay.
It's when you have speech and swallowing problems, the most common.
But really it's like somebody could have like autism, but then also someone could have like a tumor. So it just goes through like any kind of thing that's affecting.
Speech and language can be affected by like by any kind of pathology. It's just so central to who we are and stuff. So it can be affected by, a disease. It can be, you know, something you're born with, something that you acquire later in life, or just anything. I mean, it's just really, and it's an area of the brain actually that's really susceptible to having a stroke or a hemorrhage. So that's why a lot of people, when they have strokes or brain injured individuals will commonly have speech problems.
Oh, okay.
Or language problems too.
Right. Crap. No way. But crap. Crap, what did we just disagree on? Dang it.
So, but does that sound like something that you would like to ever do? Something?
No, but I
why don't you, what sounds unappealing to you? Because it all sounds really appealing to me.
Right. I just think working hands-on with people, I know you've never been a waitress, right? So, working hands-on with people, I know that's not necessarily like helping them, like, you know what I mean, progress
and like little different things. I mean, you're such a people person, work with people.
Right. I mean, regardless, I want to work with people, but I just don't want to work, like, originally I wanted to be in nursing and stuff, but then after waitressing and just dealing with how people are just, you know, so picky just about their food, it's like I don't want to know how they are about, like, their medical care. Like,
yeah.
But I know the setting I want to work in is probably a hospital, but I know that I would enjoy working in a school. So, like, I understand, like, all that. Like, I could go into something that would work in all, like, you know what I mean? Like, yours is very, like, lots of options.
And I feel like even though you are dealing with people all the time, I feel like the thing that I like about it is you're dealing with them when they have some kind of, like, crisis in their life, and you're kind of providing, like, a service that is going to help them, or hopefully help them. Not everybody gets better, but you're, like, kind of led into a really intimate situation.
That's what I was going to say. See, and I'm not like that. Like, I don't like to be like a support. Sure. Like, it's pretty much like a support system, and they're kind of counting on you to, like, help them get through it.
It's a lot of pressure, for sure. I think I like that, though.
Yeah, and then for me, instead of like being a nurse would be like that, but for me, it's like I'd rather work with people, but like be like administrative and like, I don't know, handle the paperwork and then communicate with like the other doctors or whoever, just so I don't have to. Yeah, I don't think patient care is I'm not sensitive to subjects, and it's hard for me to like, I don't know, pretend. I mean, I can like conversate with people, but I can't.
Yeah, my supervisor right now.
Not good with sympathy.
My supervisor, you definitely need some sympathy to be in those type of situations. But my supervisor right now, when she was placed at Sparrow during her clinicals, she said that like they didn't wear scrubs, but this
they were just supposed to dress casual.
Yeah, like now FLPs wear scrubs more often because like you have to deal with a lot of gross stuff. Like,
but during clinicals, I feel like you only have to dress up them.
Yeah, probably. I'll probably wear scrubs during my clinicals.
Really?
Yeah.
That's weird. Oh, maybe because
you have the option, and well, it's like it just depends on the setting. Like if I'm in the ICU, definitely like there'll be more intense stuff going on. But if I'm like an outpatient, like rehab, like where you go to physical therapy, like no, that I wouldn't wear scrubs for that. But this guy, my supervisor, he had a tracheotomy, so he had like a false trachea in here. Mm-hmm. It's called a trach is what they call it. But they took it off, and like he coughed and just spewed like some kind of substance like everywhere, and it like got all over her. And she's like, so get ready for that.
That sounds terrible. See, yeah, and I don't deal with that. And you have to deal with people's mouths too. And
all the time. Right now I spit on like every day. I never thought that I would be like okay with that, but it's like I've noticed that I'm like, you surprise yourself what you can deal with. Like a kid spit in my mouth today when he was like trying to make like that sound.
Terrible. So, terrible. No, I just can't deal with like people bodily fluids.
It's definitely not for everybody.
But on that note, thank you for listening.